pandemic and its many effects on the health and safety of Wisconsinites, we also need to keep in mind how these challenges are affecting workers in Wisconsin and their families and our state's economic recovery. Earlier this week, we announced a new partnership between DWD and Google Cloud to help our state process unemployment insurance claims and pandemic unemployment assistance claims more efficiently. And today we have another encouraging update out of the Department of Workforce Development. The DWD began releasing lost wages assistance benefits last Thursday and will continue to make payments over the next week. The Lost Wages Assistance Program is a FEMA program that provides an additional $300 per week to eligible folks who certify that they were unemployed or partially unemployed due to the pandemic. This $300 a week in additional support can help families and individuals make ends meet as we continue to navigate these times, and it's estimated this will total another roughly $224 million into the hands of up to 220,000 claimants. As I've said before, there isn't a worker or a family or an industry that hasn't felt the effects of this pandemic, and that includes Wisconsin's tourism industry, which was a $22 billion industry in 2019. That's why, as part of our major investments in small businesses and economic stabilization, we also invested nearly $12 million in providing support through our travel grant program. And this week, we announced that travel grants have been awarded to 158 grantees to help Wisconsin's tourism promotion and development organizations resume business operations and restore economic activity. Tourism plays an important role in Wisconsin's economy, and we're glad that the travel grants can provide some much-needed relief as the tourism industry and, frankly, our entire state works towards recovery. This week also marked the beginning of in-person early absentee voting in the state of Wisconsin, and we've seen amazing turnout so far. On Tuesday, the first day of early in-person voting, folks from Eau Claire to Milwaukee to Stevens Point turned out to vote, with nearly 80,000 Wisconsinites early voting in person. We also passed the 1 million mark for absentee votes cast either by mail or in person. Now that's great news, Wisconsin, and I expect those numbers will continue to grow over the next 2 weeks. So this is your reminder that you don't have to wait until November 3rd to vote. Voting early can also help your local clerks and crowds, but by allowing them to start counting ballots right away on Election Day. If you have your absentee ballot, make sure to get it in the mail as soon as possible, drop it off at an official drop box, or at your early voting locations in your neighborhood. If you want to vote in person, you can find the hours and locations for your local municipality by visiting myvote.wi.gov or by contacting your local clerk's office. Our clerks are doing great work, and they work tirelessly in every corner of the state to ensure that we have a successful election. They've adapted to the challenges brought on by the pandemic while also following state law and adopting when things change. So when you go to vote, you need to bring your photo ID, but then make sure you're helping keep other voters, our clerks, and our poll workers safe by bringing your mask, some hand sanitizer, and even your own black or blue pen if you can. If you need to learn more about what's on your ballot, check your voter registration or find your polling place. Again, visit myvote.wi.gov. Finally, I'll close today on an unfortunately somber note. Secretary Designee Palm will provide today's updated numbers in just a moment, but as of yesterday, 1,681 Wisconsinites have lost the battle against this virus, with 48 Wisconsin lives lost yesterday alone. This was the highest single-day number of deaths in the state of Wisconsin. Kathy and I send our deepest condolences to their families, their friends, their loved ones, and our thoughts are with the 182,687 who are still struggling with a positive COVID-19 test result, and the many Wisconsinites who have been hospitalized in the last few days. We've seen high levels of COVID-19 hospitalizations, with some regions reporting over 90% of their ICU beds in use. Wisconsin continues to see high levels of COVID-19 hospitalizations, with some regions reporting over 90% utilization of ICU beds. We also admitted our first patient to the alternate care facility at State Fair Park yesterday. And to those who say this pandemic has been blown out of proportion or that there isn't a real risk, folks, they're just flat out wrong. Wisconsinites in every corner of our state have experienced this virus firsthand. Families have lost loved ones. They've lost mothers, fathers, sisters, brothers, grandparents, and best friends. And our nurses, healthcare staff, and physicians are working long, frankly, emotionally exhausting hours on the front lines, caring for COVID patients and putting their own health and safety on the line. Make no mistake about this. This is an urgent crisis. If this weren't absolutely serious and if this wasn't an emergency, I wouldn't be sitting here twice a week asking you to stay home, physically distance, and wear a face covering whenever you're out. Right now, we need to listen to the public health experts, and we need to believe in science, not deny it. The best thing we can do for our COVID positive neighbors, friends, and family is to stay home, wear a mask, and continue to take every precaution to stop the spread of this virus and look out for one another. With that, I'll now turn things over to Secretary-Designee Andrea Palm for her update. Andrea, take it away.
Thanks, Governor. Good afternoon, everyone, and thanks for joining us again today. I'll start with the numbers again because they really do underscore what the governor just talked about and the severity of the situation here in our state. There are now 186,100 confirmed cases of COVID-19 in Wisconsin. That's an increase of 3,413 over yesterday. Our 7-day average of new cases is 3,396. 1 month ago, that number was 1,838, and 2 months ago, it was 707. We've now lost 1,703 Wisconsinites to COVID-19, an increase of 22 over yesterday. In mid-September, Wisconsin had 15 counties that were at very high COVID activity level. 5 weeks later, 68 of our 72 counties are above the very high threshold of at least 350 people infected with COVID-19 for every 100,000 residents. In fact, the case burden in some of our counties are 5, 6, and even 8 times higher than that threshold. COVID-19 is everywhere in our state, and it's still spreading. When activity level is this high and the trajectory of our cases is growing, gatherings of any size are not safe. Interacting with people outside of your household can easily spread the virus, and once the chain of transmission starts, it can lead to serious infections and hospitalizations across our communities. Across the state, COVID-19 hospitalizations have increased 22% this week compared to last week. In the Northwest region, that increase is much higher at 52%. The number of COVID-19 patients in the ICU is also much higher than before. Across Wisconsin, we have seen an increase of almost 21%. In 2 regions, that increase is 50% or higher. A week after opening the alternate care facility, we admitted our first patient yesterday, and we have 1 patient there today. These are stark numbers, and with our current surge in cases, our hospital numbers are going to get worse before they get better. We must take action immediately to stop transmission and get Wisconsin moving in the right direction again. Please stay home. Limit your interactions with people to only the people that you live with. Wear a mask, physically distance, wash your hands, get tested if you have symptoms or have been exposed to COVID-19. Notify your contacts and quarantine as you wait for your results and self-isolate if you test positive. To ensure that everyone who needs a test can get a test, DHS is partnering with the Wisconsin National Guard and local and tribal health departments to expand testing access to 70 new sites around the state. So please, if you need a test, get a test. You can find testing sites in your community by going to dhs.wisconsin.gov and clicking on the link that says Community Testing Site. With your help, we can stop the spread, save lives, and get Wisconsin through this crisis. Thank you.
Thank you. And we'll now take your questions. A reminder to maintain audio quality, to stay muted until it's time to ask your question. And we'll begin today with Matt Jarko from NBC 26 in Green Bay. Matt.
Yes, thanks for taking the call. This is John filling in for Matt. We were wondering, today in Green Bay, a local hospital began testing anyone with or without symptoms for COVID-19. They said this was in part due to resources provided through the state health department. Can you tell us, is this a key to slowing the spread of the virus, and should we expect more resources like this to be made available?
So I'll ask Dr. Westergaard to dig into the details, but obviously our community testing program and the increased access we're trying to provide around the state with these new sites really is about understanding where the disease is, right? It is the way we start to be able to take public health action to stop the spread. Who is positive? And testing is the way you find out the answer to that question. And so we do think it's really important for folks who need a test to get a test, and we really are anxious for folks to check out where their community testing sites are in their communities and get a test if they need one. But Dr. Westergaard, you may want to speak to the asymptomatic part of that.
Sure. I think it's very likely that the majority of new cases in the state are the result of transmission from someone that doesn't have symptoms. So that's a really important thing for people to understand about this virus. It's different than most other diseases. Most of the time, someone who has symptoms is the source of most infections. Now, it's true with this virus that if people have symptoms, they are more highly infectious. But the fact that so many people can be infected without symptoms, and the fact that there's so many of them puts that at really the highest priority of stemming the tide of new infections. So yes, the highest priority for testing people are with those with symptoms, because we need to get them out of contact with those. The second tier is people who have been exposed. So a household member of someone who has tested positive, regardless of symptoms, should be tested as soon as they can. But in this environment where the virus is spreading silently throughout the whole state, we're not going to make a dent unless we test people without symptoms. We need to develop strategies to do that in a coordinated way. But right now, it's inappropriate, in my view, for anyone to get turned away from a test because they're concerned that they've been exposed, even if they haven't been identified by a contact tracer as having been exposed. That's the situation where we are now. This virus is spreading silently. We have to presume that it's everywhere, and anyone that has access to a test should get a test.
Thank you, Matt, or John. Now to Danny Maxwell from WKO WTV in Madison. Danny?
Hi, I wanted to ask a question about contact tracers. Dane County is kind of telling us as of yesterday they no longer can guarantee a contact tracer will be able to reach out to people who are positive. And so I'm just wondering if there still is an effort to get more contact tracers, or if we're beyond that point, and what the current contact tracers are doing. Are they still interviewing cases that they had already been interviewing, or are they moving on to other duties?
Yeah, thanks, Danny. And again, Dr. Westergaard may want to dig in here a little bit, but I would say we at the state, let me step back and acknowledge that the public health infrastructure in the state of Wisconsin, when it comes to contact tracing, is beyond its capacity. What Dane County announced yesterday and what we're hearing certainly from other local public health departments is that they cannot keep up with their new daily positive cases as it relates to being able to effectively do contact tracing. It speaks really urgently to the need for all of us to take the actions together that are necessary to stop the spread, to take that pressure off the local public health infrastructure so we can get back to a place where we can contact trace in a more effective way. In answer specifically to your contact tracing question, we do continue to expand our our workforce at the state level, right? We took on the role in partnership with local public health to provide surge contact tracing capacity. We now sit at the state at 285 contact tracers. We will have an additional 47 that will start on Monday. We'll go through their training and be able to get on the phones and get in the mix on contact tracing after that, as we drive at the state towards a number of about 400 contact tracers. But again, we've got to get to a place where our daily new positive cases is not overwhelming the system, because right on the front end, it overwhelms the public health infrastructure and their ability to do contact tracing. The lagging indicators are our hospitalizations and deaths. And so until we see new daily cases go down and we start to take that pressure off local public health, it is not going to carry forward into reduced hospitalizations and deaths. And so we've got to do this work now. We've got to do it together so that all of our systems, our public health system, our healthcare system, can handle this pandemic and keep us all as healthy and safe as is possible. Did you want to say any more, Dr.
Well, I think the
Estrada?
one piece in there I'd pick up is that, like, are we past that? Are we beyond the point where contact tracing is useful? And I think the answer to that is very clearly no. And again, there's two types of contacting or interviews that contact tracers do. There are the case interviews, so everyone who tests positive gets called by a contact tracer, and they ask the questions: who have you been in contact with, and where, and what sort of gatherings have you been to? So that's a standard that we need to continue forever, because those people need support and they need advice and recommendations. The second piece that contact tracers do is all of the contacts that are identified through those interviews ideally will get contacted and notified by public health to tell them what they need to know. That's the piece where we're not able to keep up. And so there are ways that we can do that. We can educate the public about what it means to have been exposed, the need to quarantine. We can engage with cases or their families to the extent that they're able to notify their contacts. So in any of those cases, I don't think it will ever stop being beneficial to give people the advice that they need to quarantine, meaning stay out of contact with others if they've been exposed to the virus. We just right now don't have the resources to specifically call every person who's been exposed. I think it's a good goal to get back to that point, but as the Secretary said, we're not going to get back there until we really turn the curve and stop the wave of new infections.
Thank you, Danny. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hello, my question is for Governor Evers. You had said that you wouldn't be doing these briefings twice a week if this wasn't an urgent crisis, and yet, as you guys have noted, we keep seeing these new records almost every day or every week. First of all, why do you think your message isn't resonating with all Wisconsinites? And follow-up question, is it time to change your message, perhaps focusing more so on people who aren't symptomatic? For example, should everyone at this point just assume they have the virus? Thank you.
Sure. And, at the end of the day, all of this is around individual responsibility. We can do the orders, and that sets the stage and sends a message to the people of Wisconsin that, right now we have an order around face coverings. That sends a message to the people of the state of Wisconsin. That's an important thing. Wear a mask. Second of all, we have an order out there that limits public gatherings. The message around that is don't go out and hang out with a bunch of people, especially in small spaces where you can't socially distance. So we'll continue to do that. But at the end of the day, it has to be around individual responsibility. We talk about who's going to be policing this effort. Every person in Wisconsin is policing this effort. This is not something, I'm hopeful that police departments will, if they see something wrong, they'll remind people of their obligations to their neighbors around being safe. But at the end of the day, we are sending the message that you have to mask up, you have to have facial covering, and you have to be careful about public gatherings. Now, and I talk about this every week, and I'll continue talking about it. when we have inconsistent messages from our leaders, whether they're local or state or national, that's a problem. People do listen to leaders. Now, I'd say at this point in time, because of what I see every time we have a order, we end up in court, and Republicans or their allies are part of that effort. That's a problem. That sends a message to the people of Wisconsin that Republicans don't care about this. I don't believe that for a minute. I know Republicans that do wear masks. I've seen the speaker wearing a mask. So the idea that somehow Republicans are, I'm sure there's some, I read, but for the most part, I think it is a bipartisan effort. They do want you to be safe. They do want you to stay healthy. They do want you to have face coverings. They do want you to make sure that you're not hanging out with a bunch of people in a small room with nobody wearing a mask. I'm just hopeful that, because I know Republicans that feel that way. I see the actions of some Republicans. I encourage them to speak up too. This is not a one-man band here. This is an important issue in the state of Wisconsin. We have well over 3,000 deaths, cases this last 7 or 8 days. You think about preventable deaths. Let's just do the math here. I'd say on the low side, 1% of people that are identified as COVID-19 die. Yeah, it's just under that number. So think of 3,500. There's 35 people out of that group on average that will not be here. Come on, folks. Let's all get together. It's individual responsibility. This is not a political statement.
Thank you, Madeline. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yeah, thanks so much for taking my question. My question is for the public health leaders here. Is there any evidence whatsoever that any of the mitigation strategies that public health is currently performing in the state, between the mask mandate, the gathering mandate, is there any evidence whatsoever that any of it is working? Thank you.
Yeah, Rob, I'll let Dr. Ostergaard dig in a little here. I think one of the things we've talked about throughout this pandemic is the lessons we've learned from watching folks around the globe as well as states around the U.S. And I think one thing that is certainly very clear when you look at the surges that happened in the South and in other parts of the state in the months preceding the current situation that we are in, there's not a state whose hospitals were filling up the way ours are filling up that did not take mitigation strategies similar to and exceeding the ones that we have taken here in the state of Wisconsin. There's no doubt that the way you stop the spread of this virus is by reducing contact between people. The way you do that is through wearing a mask, through physical distancing, through not gathering with people outside of your home. These are tried and true, tested and proven public health interventions. And states across this country and countries around the world have used them to bring their outbreaks under control. And it is what we need to do here in the state of Wisconsin.
So I think there's a couple ways to answer that question. One is there evidence that the strategies are effective? And the evidence is very strong. And we review that scientific literature about the effect of face masks on reducing transmission, the effect of physical distancing of greater than 6 feet. So the science is very clear that those are the determinants that decide whether a person with the virus spreads it to the other. I don't think that's what you were asking, though. I think you were asking, are the policies and the messages that we've done to try to implement this strategy working? And I think it's a fair question, but I think the evidence is overwhelming that they have. What we know about the virus in terms of how quickly it spreads through a population if we do nothing is that it's very rapid and a large proportion of the people will become exposed in a relatively short period of time. We saw that in the first several weeks in the city of Wuhan in China. We saw that in April in New York City. So left to its own devices, we could have 10 times more cases and more deaths than we have right now. In fact, that's what would be expected if we didn't do infection prevention like we're doing. So the strategy that we've done, and so I think that's important for us to, the whole state, not just public health, but to acknowledge what we've accomplished. Knowing what we know about this virus, it could have been dramatically worse, 10, 20 times worse than it is. The only reason it's not is because we have done the things that the evidence shows reduces transmission, and that's face coverings in public, keeping gatherings small, hand washing, isolation, quarantine, and scaling up testing. So yes, I'd say strongly the evidence suggests that what we've been doing has made a very large difference.
Thank you, Rob. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell.
Yeah, thank you very much for the call today. Governor, it's been about a week since you asked Republican leaders to meet on COVID-19 measures, 2 weeks since they sent a similar request to you. I was just wondering if you could talk a little bit about where everything stands with that meeting. Has anything been scheduled? And if not, do you have any sense of what the holdup is? Thank you.
Yeah, and we have not heard, but clearly, I think both leaders do want to meet at some point in time. I'm guessing the national election is playing a role in that, but I have not heard, and I'm waiting for them to put some plans in place that on paper so that we can talk about that. But to answer your question directly, no, I have not received a letter to my knowledge.
Thank you, Mitchell. Now to Katrina Nickel from Fox 11 in Green Bay. Katrina?
Hi there. Thanks for taking this question. So my question is for Governor Evers. More about this, bipartisan. You said you want to make a bipartisan effort to help reduce the spread of the virus. So where's the disconnect, and what's the solution to get everybody on the same page?
Great question. We've been trying to be on the same page for some time. Hopefully, at some point in time in the near future, we'll sit down with the Republican leaders and determine whether those mitigation strategies that we know work. And I'll repeat them again: facial coverings, making sure that you're socially distant, and be concerned about public gatherings. What can we do together on that? And whether it's something legislatively or not. But we have to have folks understand how important this is, and that if their caucus is not on board with facial coverings and social distancing, then there won't be any in agreement.